I'm Travis Tollefson. I'm a facial plastic surgeon at UC Davis in Sacramento. I'm on the board of directors here for about 5 years now, and it's been an extraordinary experience to, I'd say, professional development as an individual within the board, and to know the mission and the vision of what we seek, and that's protection of patients, but also supporting and advocating for our the surgeons that we serve. I was asked to serve on the task force to writing questions, which is a challenge. And these board questions that you're writing are trying to capture real life situations where there are right and wrong answers, and sometimes there's gray area. And I think one of my favorite things to think about is the 49%, 51% decision, where it's not exactly clear which way it should go, but somebody has to make that choice. And I think what we do is sit there and try to find what's going to be the best practices for surgeons and in their own practices in their own communities. In the process of creating content and creating ways to create judgments about how well someone has trained or what practice they've started to develop, you are doing this out of a love for your community and for the other people that are serving your own family members. So I look at it every time in that board service is trying to establish the standard that you'd want your own grandmother, mother, and parents taken care of. And if you can put that in your mind, that it is hard to fulfill the requirements for board eligibility, for board certification, but that effort in the long run is putting people in front of you when you need an otolaryngologist that you trust and that you would take your own family to. I've been serving as a director for around 5 years. Before that, I served as a senior examiner and a guest examiner. And I will just imagine that I'm in about my 15th year, 12th to 15th year. The bottom line, most exciting and the thing that drives people, I think, for board service is the collegiality, because you have cross disciplines. Let's be honest, otolaryngology, head and neck surgery is at least 5 subspecialties. We're all very different. The laryngologists in one room, the otologists in another. Everyone dresses a little different, has different practices, but then we come together to serve a common purpose. It as facial plastic surgeons sometimes have practices that are entirely cosmetic, where there's no insurance billing at all. It's all cash payment. And then there's certain pediatric otolaryngologists that serve in communities where there's extremely underinsured patients. So it's such a breadth, and to bring everybody together to talk about their own practices and to raise the level of care, I think is a real, it's the big benefit for board service. As I joined, I watched an incredible transition and inclusion into the board of individuals that represent those that they serve, that they represent from a private practice standpoint, from a gender standpoint, from a race and ethnicity standpoint. And I'm very proud to look at and stand next to those board of directors and our examiners and our senior counselors, and to know that the representation now demonstrates an extraordinary congruence between those we serve and the volunteer service that we provide. I have spent a lot of time listening to people tell the story of what they want to achieve, and board service is a direct line to be able to sit next to the best and brightest and to work together to better our specialty and to better yourself as an individual from a leadership standpoint. And it's a selfless thing to be able to volunteer, because in the end you actually get more out of it than you give.